We work in providing independent medical education for healthcare professionals via our hubs. So we have 9 hubs live at the moment, 7 in the heme-oncology space and 2 in the immunology space, and looking to launch a few more in the future. We also run patient awareness and education campaigns as well. So this puts us in a really unique position where we have experts in-house in patient education and healthcare professional education. And one of the things which we're really keen on doing is incorporating the patient voice into our healthcare professional education. And it's something which we've started to do in many different ways. If we move on to the next slide, Beth. So across all of our programs, we start by doing an educational needs assessment. So working out what the educational needs are in the space that healthcare professionals need to solve practice gaps and knowledge gaps in their clinical practice. And as part of this needs assessment, we do literature reviews, we have discussions with the healthcare professionals themselves. But importantly, we also interview patients as part of this to see what they think the healthcare professionals need to improve on. We work with patient societies and interview key members of their boards as well. And we also do social listening activities. So looking at social media, patient organizations' social media accounts and looking at what key trends are in terms of patients asking, conveying their problems and which ones we can solve. We then take this through into educational design. So we actually invite patients to sit on our steering committees alongside healthcare professionals to make sure that their voice is heard and ensure that when we're designing any of our educational initiatives that we're taking their perspective on board. We work with patient advocacy groups too and have their collaboration with some of our educational profiles to make sure that we're hearing their voices. And we also work with patient societies as partners, both in the educational design and also in the dissemination of our educational programs as well, to make sure we are reaching as many people as possible. We also do ongoing literature reviews, and these don't just focus on the healthcare professional side of things or drug updates. We also look at those social listenings, looking at patient articles of interest and make sure that they build into the education that we're producing for our programs as well. And then as a step 3 evaluation, we look to see whether all of this has worked. And mainly we do this by almost repeating step 1 and circling back and interviewing those same patients, speaking to the societies and speaking to the people who sit on our steering committees and collaborative groups to see whether or not what we're doing is working.